Good morning, ma'am. I am your student nurse. I am Mr. Dalmar C. Yepes. Today, I will be performing a neurologic assessment. So, when I say neurologic assessment, pertaining to our nervous system. So, we have the central nervous system and we have the peripheral nervous system. So, in the central nervous system, we have the brain and the spinal cord. In the peripheral nervous system, we have the cranial nerves and we have the spinal nerves. So, as we all know that the nervous system is one of the most and vital body systems in our body because it is the main control, because it signals to our body for a sensory and motor function. So this morning I have my patient here. So first is we're going to gather all the equipments. I have here the patient gown. I have here the tuning fork and that I'll be using later on. I have here the light. I have here the this is the hammer. This is the improvised tuning fork. And I have here the newsprint to read. Right. So first of all, of course you have to identify your patient. So your patient is, if that's the right patient for you to be assessed with, make sure that your patient is comfortable, and you need to explain the procedure to the client. The procedure, and you need to provide privacy. So in this case, our client does not have it's not necessary to wear a gown, but this time I'll be asked my client to wear a patient gown to provide privacy. Sir, can you please wear this? Sir, move. So next is, first we're going to check, okay, the mental status of our client. So first, you need to assess the level of consciousness. So in this case, our patient has no sign. The level of consciousness is there's no sign of any abnormalities or unusualities. The patient can be able to participate well. There's no any signs of syncope or of loss of consciousness. And next is the appearance and the behavior. Our client seems to have a good appearance and in a very well versed and good behavior. And the feelings, and of course the process and perceptions and the cognitive abilities. So in this case, can be able to participate of my instructions, and my patient is in the normal findings. Next to perform is we need to discuss first is cranial nerves. So as we all know that we have 12 cranial nerves, so we will be going to discuss that one by one. Alright, let's start with the cranial nerves 1, which is the brain, that is sensory to smell something. If the patient can be able to identify, can you please know this one? Smell, right? So my client can be able to smell, can be able to identify, and my patient is in the normal. Number 2, the cranial nerve 2, that is the optic or the sight of seeing. So we have this. Okay, we need to check, of course, the visual acuity, right, of the vision or the vision acuity of our client. Sir, I have asked my client to first to look at the chart. Okay, so sir, what can you see, sir? Right, so my client can be able to see the Snellen chart, okay, that object. So my patient has a good visual acuity. Although my client is 60-year-old, he's now using a eyeglass since that is part of aging. So they need to use a eyeglass because that's normal in their age. So next to do is the cranial nerve number 3, which is the oculomotor. it's involved the eye. So it is both, it is more on motor because we are going to check the movement of the movement of the eye. So they are actually, it is the cranial number 4 and cranial number 4, cranial number 6, which is the cranial number 4, it is the tropical eye, and the cranial number 6, it is the abducens. So we need to check, of course, to check the corneal reflex. So we need to check the movement of the eye, okay, the margin, okay, the reflexes. So in this case, sir, excuse me, can you move your eye, sir? Can you please look to the side? Right, so in this case, so there's no any abnormality, unusualities. So in this case, the patient can respond well. Alright, the patient can be able to move her eyes well in the different direction as the instructions being given to her, to him. So, next to perform is the cranial number 5. Cranial nerve number 5 is a trigeminal. It's about the face. It's about the face movement. So, we need to check, of course, if there's any disproportional facial muscles. So, in this case, so since my patient is 60 years old, so as you can see, so there's a significant or there's a sign of the facial muscles is already sag. So in this case, normal findings. Next to perform number 7 is the facial. Okay, then okay, you try to check the mandibular. So in this case, okay, if the patient can be able to move face, sir, can you please no, can you please up, down, right? So let's proceed to the acoustic. Okay, so also you're going to check, all right, the conductive hearing or the sensory, okay, cochlear hearing of our patient. So with that, we're going to perform, of course, is the Weber test, the whisper test, the Rene's test, and the Romberg test. So in this case, so I'm going to use the improvised counting fork. So in this one, we're going to perform the Weber test to check if there's any hearing conductions, to check, of course, if there's any signs of hearing loss. Right? So the patient can be able to feel, or can be able to. So the patient can be able to feel, to sense, okay, the conductions of that vibrations. So next is, sir, can you please stand? Now we're going to check the Romberg test. Okay, by checking the patient, right? If there's a partial swaying, right? So I mean to say, the patient can be able to stand, okay? So I mean to say, there's no any abnormalities, unusualities, so the patient can be able to balance his body, okay? That is the Romberg test. Sir, can you please sit down? Next to perform is the cranial number. The cranial number 10, it's all about the glossopharyngeal. So we're going to check, of course, the gag reflex. So this one, gag reflex, it is actually a reflex that can that is visible throughout the age. So okay, that is actually existed. This kind of reflex is being existed until your throughout your age, throughout your life, right? So by doing the gag reflex, of course, you need to have to stimulate. Alright, on the palate. If there's a gag reflex, it means your patient is in the normal findings. But in this case, the patient is in the normal findings. Next to check is the cranial nerve number 10. And the number 10 is the vagus. Okay, it is also to check, okay, the the ability to swallow. Okay, that's involved actually both the sensory and the motor. So in this case, the patient can be able to swallow. Cranial number 11 is the spinal accessory. So that's about checking the shoulders. So we need to surround the shoulders. It's involved the sternum of the muscles and of the shoes. So we need to say if there's any movement, okay, during that procedure, it means the patient can be able to move. And last is the cranial number 12. It is the hypoglossal tongue. So we're going to check, of course, the protrusions of the tongue. Sir, can you please your tongue? Then on your tongue. Tongue. Labas. Bila. Okay. Okay, so in this case, so the patient can be able to protrude his tongue. So in this case, okay, out of those 12 cranial nervous system, cranial nerves, so there's only one, all right, problem. So it's only the cranial number 2, the site, okay, the site of the patient, because due to his aging. Okay, so but the rest cranial nerves are well functioned, and it can be actually seen by the response of the client, if the client can actually respond well through or to different stimulus. And now we're going to check the mental status of our client. So when we say mental status, we're going to check, alright, the mental alertness of our client. If the client can be able to respond well to the stimulus, alright, if the client can be able to move freely his body, if there's any coordination. So now let's check for the test the conditions and the movement of the muscle. So any part of the body that involved muscles. So can you please move up? Okay. Can you stand, sir? Okay. Can you sway your... Okay. Move. Okay. So sit. Can you please sit? So in this case, okay, the patient is in the good conditions. It means he can balance her body. It has a body musculoskeletal coordination. Meaning to say that if the patient's body can be able to move freely, right, without any distractions, and can follow instructions, and responds to any stimuli. So meaning to say, our patient is in the good mental status. And now let's proceed to the, it is all about the motor and the cerebral systems, okay? Next is the sensory system. So with the sensory system, it is all about the senses. So we're going to check, okay, the light, the touch. Of course, since the location is very well lighted, so can you please look around, sir? Okay. So the patient can be able to sense and to see, okay, the environment, the surroundings, right? So the pain, how about the pain? Okay, so the patient has been stimulated, okay, and the patient can be able to feel the pain. The temperature, the vibrator, and the tactile discrimination. So in this case, the patient can be able to, can be able to sense pain, okay, the temperature of the surroundings, the vibrator. So in this case, the problem is there's no any abnormalities. And now let's proceed to to check the reflexes. Alright, so in the reflexes, we're going to check, of course, the deep tendon reflex, the superficial reflex, and next is the Brzezinski reflex or the Kern reflex. Alright, sir, can you please move? So my client is facing. Okay, so I'll be going to perform this. Right, so I have here the improvised hammer. Alright, so first to perform is the triceps and the biceps. Okay, so So now to check on the and then the brachioradialis reflex and the patellar reflex. In checking the reflexes, it should be voluntary, okay, it has a voluntary movement. So next to perform is the Achilles reflex. So sir, can you please move? Okay, on the Achilles. So I'll be going to okay, so out of those deep tendon reflex, I mean to say that those reflexes are responding well. Next is the superficial, but we cannot actually perform the superficial reflex because it involves the abdominal, the anal, the cremasteric, the bulbocardinerosus, and the plantar reflex or the Babinski reflex. And lastly, to perform is about the Brazilian reflex or the cranial reflex. Of course, we need to, first sir, can you please lay down? Lay down. So, in this kind of reflex is if to check if there is any presence of meningeal infections in the body. So, of course, you need to ask the, okay, to move, to ask the flex, to raise the legs, okay. I mean to say, if going to raise the legs, if there's any positive response, right? So in this case, there's no any signs of any meningeal infections. But if you're going to raise these legs, and there will be a flexions, there will be a involuntary flexions of the head. I mean to say that the patient has a present. As a what do you call this? As a presence of infection. Alright, so sir, can you please sit? So this is the procedure or the assessment of the neurologic assessment. So first that we're going to perform is about the mentals, right? To check the level of consciousness down to the 12 cranial nerves. The body can be able to respond well according to the specific nerves in the body. And of course, the motor and cerebral, okay, to check of course the conditions, of course the body coordinations, the muscles and the balance of our client. And of course, the sensory system in order to check if the patient can be able to touch, can feel the touch, the pain and body temp or vibrator that can be felt in the surroundings or in the stimulus. And lastly will be the reflexes. So the reflexes involves a deep tendon reflex, the superficial reflex, and the Brazilian reflex that we're going to check the meningeal, if there's a signs of meningeal infection. So after this, okay, you need to ask the client, okay, sir, we're done with our neurologic assessment. If there's any abnormalities, ask or advise the client to wait for the result. If there's any abnormalities, tell the client, advise the client to be referred to any to a doctor for further analysis and to further management. So after this one, I'll be going to remove my gloves, right? So of course, do hand washing as for the hospital infection control policy. So in this case, so after this one, you need to do a documentation. You need to formulate nursing diagnosis or collaborative problems and make referrals for further management. So that is my virtual demonstrations of the neurologic assessment. Thank you so much.